What is epilepsy?
Well, let me explain.
Epilepsy is a chronic non-communicable disease which interferes with your brain cells that affect people of all ages. It causes frequent seizures and start at any age, but usually it happens during your childhood and to people over 60 years old. Seizures sometimes only cause a few muscles to twitch, but they may also cause your whole body to convulse. Epilepsy can be different for each person, so the need for care may be vary for each. Some people only need care when they have had a seizures, and some do not need any additional care from the others.
Causes of epilepsy.
Epilepsy is not contagious. Although many underlying disease mechanisms can lead to epilepsy, this disease has no identifiable cause in about 50% of cases globally. In the other 50%, the condition may be traced to various factors, including androgenetic influence, head trauma because of traumatic injury, abnormalities in brain, including brain tumor, prenatal injury, and developmental disorders like autism.
Signs and symptoms. The most common symptoms of epilepsy is a seizure and differ from person to person according to the type of seizure. Doctor classifies seizure as either focal or generalized. Focal seizure. Focal seizure result from abnormal activity in one part of the brain. A focal seizure may be simple or complex. The symptoms of simple focal seizure include dizziness, change in sense of taste, and twitching of limb. While the symptoms of complex focal seizure include are responsive to the environment and staring blankly into the space. Generalized seizure. The generalized seizure involves the whole brain. The symptoms include tonic seizure that can cause muscle stiffness, myoclonic seizure that can cause twitching of the arm and leg, and tonic-clonic seizure that can cause shaking, loss of consciousness, and stiffening of the body.
How to treat seizure.
Hey, I'm Tasha. I'm the one in gray shirt. I love playing badminton. All my friends say I'm pretty good. Did you know our brain sends messages to our body to tell it how to move? Well, sometimes my brain gets the messages a little bit mixed up and my body goes stiff and starts to shake. It's a type of seizure.
And don't be scared if this happens, you can help me.
First, move anything away from me that might hurt me. Put something soft like a pillow behind my back and stay with me. My seizure won't last long. Hi, I'm Adia. Ever since I was a baby, I've had a type of seizure. It happens when my brain sends mix-up messages to my body and I do things I can't control. Things like my face might twitch. Sometimes I don't know what happens and I cannot think clearly. When this happens, you can help me. First of all, check if I can hear you and move anything dangerous away from me. And then, send someone to get an adult. Please wait with me until my seizure ends.
Hey, Assalamualaikum doctor. How are you?
Waalaikumsalam. Alhamdulillah, good.
Are you free right now? If you are, we want to ask you some questions about epilepsy.
Oh, sure.
First question is, what will happen if the patient do not take the prescribed medicine?
Seizure will happen more often and more longer, and more severe than previous episode. So the duration of seizure is more than 5 minutes, which is called as a status epilepticus.
Oh, I see. If the seizure happen more than 5 minutes, we are supposed to call the ambulance, right? So, what action will be taken by the doctor?
First, we'll move anything that can hurt the patient away from them, and then check the patient response and put pillow or anything soft or of cervical collar available applied on the patient neck to protect patient cervical spine. So we will secure the patient airway by giving oxygen if there is some chest movement. That means they can still breathe and monitor vital signs to keep on track with the circulation. We also put patient in lateral decubitus position and do suction if required. So we secure IV line, access for IV fix, resuscitation, and obtain blood for glucose level and ABG. And also we give the medication such as benzodiazepine is also one of the action.
Oh, I understand. How is epilepsy diagnosed?
We will check the cause of epilepsy by blood investigation, CBC, glucose level, serum electrolyte, MRI, and CT scan. So basically, we will try to find the cause of the symptom. If all are normal, then do EEG, which is electroencephalogram, because epilepsy varies. Diagnosis require tests and history and also the clinic examination.
Oh, I see. Thank you for spending your time with us.
You're welcome.
There are still many misconceptions about epilepsy that are caused by lack of awareness in the community. This may cause people with epilepsy become uncomfortable to talk about their epilepsy experiences and what measures should be taken if seizures happen. Now, let's clear up your confusion and learn about misconceptions of epilepsy. Firstly, many people mistake epilepsy and seizures for mental illness. This can happen when someone makes strange noises, uses unusual words, or acts oddly during a seizure. However, people with epilepsy can also have mental health problems like anxiety or depression just like anyone else. There are also a lot of people who think that you should restrain someone that are having a seizure. Actually, doing this will not stop or slow down the seizure. In fact, it can cause muscle injury for the patient and cause other harms. Another misconception on how to deal with epilepsy is by putting something on the patient's mouth during a seizure. This is because many people think that person who has seizures will swallow their tongue, but in reality, is physically impossible. Putting something in their mouth may injure their teeth or jaw. Instead, what you can do is to roll the person on one side and wait for them until they become conscious.